In today's lecture, we are going to study about cholinergic agonist. In previous lecture, we studied about the two main divisions of autonomic nervous system, the parasympathetic and the sympathetic nervous system. For today, we will only study about the parasympathetic or cholinergic agonists. But before that, we have to learn about how a cholinergic neuron works. In the first step, for the synthesis of acetylcholine, choline molecule enters the neuron through sodium ion gated channels. Choline combines with acetyl-CoA to produce acetylcholine. Acetylcholine is then stored in presynaptic vesicles. Then an action potential causes calcium ions to enter the neuron and causes the release of acetylcholine in the synaptic cleft. Two things can influence the release of acetylcholine at this point. Botox inhibits the release, while black widow spider enhances the release of acetylcholine, which later causes cholinergic crisis. Acetylcholine can then either act on the muscarinic and nicotinic receptors to produce response in the postsynaptic neuron, or it can either be broken down by the acetylcholine esterase enzyme, which breaks the acetylcholine into choline and acetate molecule. Now let's talk about the cholinergic receptors. Cholinergic receptors are of two main types, the muscarinic receptors and the nicotinic receptors. Muscarinic receptors are of five types, of which M1, M2, and M3 are significantly important therapeutically, and we do not study the last two because they are not therapeutically important or studied. Then there are two types of nicotinic receptors, an N receptors and an M receptor. Muscarinic M1 receptors have functions on gastric glands where they increase the motility and secretion of the gastric glands. M2 receptors are present on the SA and AV nodal cells of the cardiac muscles, and M3 receptors are present on numerous smooth muscle cells around the body like salivary glands, eyes, lungs, and GIT tract. The nicotinic receptors are of two types as we studied before. The NN receptor is present between the ganglion inside the CNS, on the adrenal medulla and autonomic ganglias, and the NM receptors is present between the nerve endings and the muscles at the neuromuscular junctions of skeletal muscles. When acetylcholine acts on M1 and M3 receptors, they stimulate the receptors and it causes enhancement of the action, while when acetylcholine acts on the M2 receptor, it inhibits the action. While the nicotinic receptors are of dual action, they are stimulated when the nicotine is present in low concentration and are inhibited when nicotine is present in low concentration. So that's why they have this dual action. Now let's talk about the cholinergic agonist or the cholinergic drugs. The cholinergic agonists are of two types, the direct acting agonist and the indirect acting agonist. The indirect acting agonists are then further divided into reversible and irreversible due to their duration of action. The reversible are of short acting and intermediate acting. Irreversible means they are long acting. Let's talk about them in detail now. The acetylcholine is an example of the endogenous acetylcholine. As a drug, acetylcholine is a quaternary amine, which means that it is positively charged and it cannot cross the blood-brain barrier or enter the CNS. It is quickly degradable, means it is easily broken down by acetylcholinesterase. Then it has diffuse action. It means that it has action on the muscarinic and nicotinic receptors, which makes its action diffuse and kind of drawback for this drug. Its stimulation on the blood vessels causes the nitric oxide production, and due to the nitric oxide production, it can cause vasodilation, and that can result in the drop in blood pressure. The acetylcholine action on the GIT tract causes increase in the motility of the GIT tract as well as increase in the secretion of the gastric glands. In eyes, this causes pupil constriction, also known as miosis. On bladder, it causes the contraction of the detrusor muscles, inducing urination. And on lungs, it causes bronchoconstriction, making it difficult to breathe sometimes. Due to its extensive cholinergic effects, it is only used ophthalmically in eye surgeries for miosis. The next direct acting cholinergic agonist includes bethanical. Bethanical is a quaternary amine, which means it cannot cross the blood-brain barrier. It is not degradable by acetylcholinesterase, which make it long-acting as compared to the acetylcholine, and it has action only on M1 and M3 receptors, which also is sometimes therapeutically an advantage. On M1 receptors causes increase in the motility and secretion, which makes it usable or beneficial in the treatment of constipation and megacolon, toxic megacolon especially. And for its action on the M3 receptor, it could be used in conditions like atonic bladder and non-obstructive urinary retention. Then we have the third drug called carbachol. Carbachol is also a quaternary amine, which means that it cannot cross the blood-brain barrier. It is not degradable by acetylcholinesterase, which again makes it a therapeutic advantage over some drugs. It has also a diffuse action on the muscarinic and nicotinic receptors, and sometimes it's not required, so it could be a drawback. And that's why it is only used ophthalmically for open angle glaucoma, and it is used for major eye surgeries for doing meiosis. Then comes another drug called pilocarpine. Pilocarpine is a tertiary amine, which means that it is not um, charged, and it could cross the blood-brain barrier and cause CNS toxicity. It is mostly acting on the muscarinic receptors, and it is therefore therapeutically used in ophthalmically for dry eyes and glaucoma or for doing mydriasis. Yes, and that was all from direct acting cholinergic agonist. Now we will study about the indirect acting cholinergic agonist. Indirect acting cholinergic agonists are those agonists which not directly act on the receptors but inhibits the acetylcholinesterase enzyme for indefinite time. So the reversible includes adrophonium. Adrophonium is a short acting indirect agonist. It means that it could be reversed, and the duration of action is 10 to 20 minutes. The drug is quaternary amine, which means that it cannot cross the blood-brain barrier, and so it could be used. The therapeutic use is that it could be used for the diagnosis of myasthenia gravis. For those who don't know, myasthenia gravis is an autoimmune disorder in which the neuromuscular junctions are destroyed, resulting in very low cholinergic response or activity. So for that purpose, we want to enhance the acetylcholine activity. So we inhibit the acetylcholinesterase reversibly for indefinite time, and this could be done by hydrophonium. And with hydrophonium administration, a rapid muscle contraction is seen in the patients. So this could be used for diagnosis of myasthenia gravis, and then it could be used for the differentiation of myasthenia gravis crisis and cholinergic crisis. As we spoke before, that myasthenia gravis will be improved with this administration of hydrophonium, while the cholinergic crisis will be getting worse with the administration of hydrophonium because it itself is enhancing the activity of acetylcholine. Third one, it could be used to reverse the effects of neuromuscular blockers because it increases the acetylcholine activity and increases the muscle contractility. So this was from the hydrophonium. Then comes the another drug, physostigmine. Physostigmine is an intermediate acting agonist. It means that it could be the duration of action is a bit more than hydrophonium, uh, from 30 minutes to 2 hours. Tertiary amine means it can cross the blood-brain barrier, and this is the drawback of it. It has a non-specific response on the muscarinic and nicotinic receptors, which is also another drawback of this physostigmine. It could cause the CNS toxicity. The therapeutic use of physostigmine is that it could be used for the cholinergic antagonist reversal. For example, if there is atropine toxicity, atropine overdose, it could be reversed with the help of this. Neostigmine is another indirect acting agonist, very similar to physostigmine, but it is a quaternary amine, which means that it does not cross the blood-brain barrier. so a beneficial point, and it has a very specific action on the neuromuscular junction and M1 and M3. So that makes it very therapeutically specific for some reasons. It is intermediate acting, and the duration of action is from 30 minutes to 2 hours. Therapeutically, it could be used in acute myasthenia gravis management and the neuromuscular blocker reversal as after the surgery or in anesthesia, to reverse the action of anesthesia. The adverse effect is very much understandable. It could cause the generalized cholinergic responses. Then there is pyridostigmine. Pyridostigmine is again a quaternary amine. It is intermediate acting. The action is from 30 minutes to 2 hours, but the duration of action is a little bit more as compared to the neostigmine, from 3 hours to 6 hours. Therapeutically, it could be used in the chronic management of the myasthenia gravis, and the adverse effect is very much similar to the neostigmine, that is cholinergic, generalized cholinergic crisis. The indirect acting cholinergic agonists are also used in the treatment, or not treatment exactly, but the management of Alzheimer's disease. For those who don't know, Alzheimer's disease is a degenerative disease where there is a degeneration of cholinergic neurons, destruction of the cholinergic neurons in the CNS, and due to that, there is a decrease in the acetylcholine levels, and that makes the muscle weakness in the patient of Alzheimer's disease. So the drugs which could be used are indirect acting cholinergic agonists to increase the acetylcholine activity, and these drugs will inhibit the acetylcholinesterase temporarily, and it will temporarily improve the muscle activity of the Alzheimer's patient. Then the drugs which includes donepezil, rivastigmine, galantamine, and these could be remembered with DR. So this was all from the reversible indirect acting cholinergic agonist. Now we will study the irreversible indirect acting cholinergic agonist. Indirect acting cholinergic agonist, or irreversible, means that they bind covalently or permanently to the acetylcholinesterase enzyme in the synaptic cleft, and they permanently block the acetylcholinesterase activity. It provides longer lasting effect, and but it could be extremely toxic. It could create acetylcholine crisis. So that is why it is only used for military purposes and insecticides. The example could be ecothiophate. Ecothiophate is used as an organophosphate that binds permanently to the acetylcholinesterase enzyme, and the effect could be generalized cholinergic stimulation, like it could lead to convulsions, it could lead to bronchospasm, intense meiosis, and intense bradycardia in patients. Adverse effects that if it is used ophthalmically, it could cause cataract. Right, so this was all from today's lecture. Hope you guys enjoyed. Please subscribe and share the lecture. Thank you very much.